Hey guys, Dan here with Pain For You. The topic of this video is forget everything you've been told by your doctors. And I know that sounds very dismissive of the medical community out there. But if you have TMS, MindBody Syndrome, psychophysiological disorders, these chronic pain and chronic symptoms as a result of too much stress, I'm really strongly encouraging you to forget everything you've been told. If you've been to doctors and they've given you a variety of diagnoses, forget everything you've been told. If you've gone to Wikipedia and Dr. Google and read a whole bunch of stuff about the things that you've got going on with your body, forget everything you've read. None of that stuff matters. Understand that too much stress, this psychophysiological disorder, this chronic pain to distract us from our overwhelming negative emotions. That's what's going on. If you're not sure, do the assessment and make a decision that that is what's going on for you. And then once you've done that, forget everything else that you've been told. Because a bulging disc in C4 or S4 or whatever it is doesn't matter, right? And if you think it does, you haven't learned enough about what's going on. You haven't embraced the fact that this is what's going on for you. So forgetting what you've been told is one of the key components, because look guys, I got a fence right here. All right, right here. And you can't sit on this fence and get better. You can't say, I believe this thing, TMS, this mind-body stuff exists, but I still have a bulging disc, so I might still have a problem. You're not going to get better sitting on the fence. I'm encouraging you to say, okay, great, I've got a bulging disc. It's a normal sign of aging. 2/3 of the population has bulging and herniated discs, whether they've got pain or not. So these things don't matter. The physical findings that your doctor found don't matter. Look, again, I'm not a doctor. I'm not telling you to ignore your doctors. Go get checked out physically and ask them to rule out anything life-threatening. Most of the other stuff doesn't matter. Incidental findings. Decide you've got TMS. Decide you've got mind-body syndrome, this distraction pain, and forget everything else you've been told about what's wrong with your body. You know, you might think, well, I've got all these problems with my digestive system. Okay. Well, keep in mind, stress, which can be caused by negative emotions, repressed emotions, causes the digestive system to be suppressed. So if that happens, saliva, digestive enzymes, all of these things stop working. That can cause everything from IBS to constipation to stomach pain to you name it. And it's all as a result of stress. So even though they may scope you and say, yeah, we can see some problems in your digestive system, that doesn't mean that's the cause. That may be the outcome. So forget everything you've been told. Recognize that stress, let's say you've got an autoimmune disorder, right? Same thing. Stress suppresses the immune system. So if you've got inflammation, if you've got any type of autoimmune disorder, recognize that that is the outcome of too much stress. And again, the emotions can be the source of that stress. So again, you may have been diagnosed with an autoimmune disorder, and some of them, it may be helpful to have some medical intervention while you're working through it. But understand, in my opinion, that if not the sole cause, too much stress is a largely contributing factor to all sorts of medical challenges. So whether it be digestive, autoimmune, chronic pain, chronic headaches, you name it, too much stress, TMS, too much stress is often, if not the only cause of these symptoms, a largely contributory cause, which means you may have a true autoimmune disorder going on, but if you're immune system wasn't chronically suppressed from too much stress or being in fight or flight too often, your immune system might just work much better. So, de-stress, learn to soothe yourself, bring yourself out of fight or flight and into rest and recover. You know, sympathetic nervous system, parasympathetic nervous system, understand what those are, and, you know, get out of fight or flight as often as you can. And if your thoughts are what's putting you into fight or flight, become aware of that, notice that, and realize that simply too much stress is what got you into this mess in the first place, and then stressing about these stress illnesses is what's keeping you there. So look, guys, gain the knowledge, do the assessment, and then commit that, look, fear is not going to help me here. Fear is just going to keep me in the stress mode and keep these symptoms persistent. That's why the mindset is such a big deal. If you can get your mind dialed in and turn down your fear, turn down your stress over these stress illnesses, you're golden. This does not have to be that complex. Yes, it's challenging. Why? Because we're in such a habit of thinking negatively and catastrophizing and everything else. But it's not that difficult to comprehend how this stuff works. So, when I say forget everything you've been told, I mean, if you've been told that there's nothing life-threatening, remember that. If you've been told you've got a bulging disc, that's fine. The diagnosis is the diagnosis, but don't listen to that prognosis which says, yep, you're going to have pain for the rest of your life. Forget that. It's not true. I feel better now at 54 than I did at 34, or even at 31 or 32 when I first got the pain. I feel better now. So aging does not necessarily mean pain. That's a common misperception. It's, I don't know. You know, I look at the demographics of the people in my Pain For You group, and it's really interesting. You know, teenagers, none, 20s, starting to see it climb up, 30s, 40s, 50s, you know, that's where the peak of the number of people are. And then after you get around 65, the numbers decline significantly. Now, that may be explained by the fact that there's not as many 70-year-olds, 80-year-olds in Facebook groups. I get it. But Dr. Sarno, I believe, was the one who pointed it out, that the age of responsibility between 30s, 40s, 50s, when we've got the most responsibilities for caring for our kids, our families, our careers, tends to be when most of these symptoms happen. And then as we get older, a lot of times these pains go away. Why? Because we've got less stress and we've become a little bit more comfortable with who we are. So anyway, I guess that was a short, side note on aging. But forget what you've been told as it relates to this is your reason for pain. Because invariably the doctors are wrong. Dr. Google is wrong. Wikipedia and WebMD are wrong. You are not broken. You are not destined to a life of illness and chronic pain. You've just got TMS, too much stress. And these repressed emotions seem too scary and dangerous, so your brain has decided, I need to protect you from them, and here comes a distraction. And so, again, it's all core knowledge, assessment. Do the emotional discovery work. Teach yourself that these emotions are not dangerous. Then get the mindset dialed in and you'll be fine. I know I repeat myself every time, but honestly, that is as simple as I can make it. And I'm repeating myself even saying that. But it really is not that difficult to get out of pain. Just get these core areas dialed in and you'll be good. So, forget everything you learned from your doctors about the reasons why your body is at fault and your body is broken. It's not true. Talk to you soon.